I was hit by a car 2 years ago and now I have PCS, and every time I get anxiety, it triggers my symptoms. Will this ever go away? Here's the thing. Okay, great question. Anxiety, the symptoms of anxiety look the exact same as the symptoms of concussion. So what I would say is deal with the anxiety. If you can deal with the anxiety, right, you'll get rid of the trigger that causes the other symptoms. So it's really that way, right? And I have a lot of patients that will have had a concussion as an inciting incident or event, and they'll come in, we'll work on some stuff, and mostly what they're dealing with is an anxiety issue. And so they will go through talk therapy, they may go through a short course of medication or something like that, but once they get that part in check, that's when they start to feel better. So concussion can cause anxiety disorders, concussion can cause depression, and dealing with the mental health aspect is probably the biggest step forward you can make in your recovery. If you have ongoing anxiety and you can't deal with that piece, or you're not handling that piece, all the other stuff is just useless, right? So I would say just deal with the anxiety as if it's an anxiety disorder. Go through, talk therapy. Well, now it's a lot of virtual stuff. Find a social worker, psychologist, something like that you can start working on the anxiety piece, get strategies to deal with that. Do things like meditation, exercise, etc. Things to reduce the anxiety. Because if you can reduce the anxiety, you'll reduce the symptoms that you're dealing with and suffering with. So that would be my number one recommendation for you.